a soccer player having ankle pain, and it's super common in soccer for multiple reasons. You can have an ankle sprain, so either an inversion where you sprain where your ankle goes to the outside, or an inversion that can happen. We also see a lot of think of them as compression injuries, where as you're kicking the ball, your toe hits the ground and it forces you into what's called plantar flexion, where you point your toe down. That can stretch the ligaments and the tendons in the front of your ankle. It can also compress the structures, the bones and soft tissue in the back. So there's that, as well as many Achilles tendon, as well as all the tendons that go down into the feet. All of those can become injured during soccer, and it's very common to have any of those overuse injuries, as well as traumatic sprains or strains. So those are all the possibilities, and it takes a very thorough assessment to find out which one of those you're having. To assess your ankle, what we would do is take you through a broad series of movements, starting at your head actually, and moving all the way down to your feet and ankle. And what we're looking for is, where are you restricted, where are you having pain, and what areas could possibly contribute to the pain that you're having. So that gives us an initial area to start to look further down the chain to find out where you're compensating and where you're not. So sometimes it's just an overuse injury. Sometimes it's an acute injury where there was a moment where all of a sudden you felt the pain. So we'll take you through that range of motion series. We'll also do a neurological test to make sure you're not having any neurological deficits of any kind, so weakness, numbness, tingling, anything like that, because that can happen also just as common. So ruling out any red flags, also checking to see muscle testing to see where you're strong and where you're weak, to find out where you're deficient. Once we have all of that, we come together and create a diagnosis so that we're super clear on what the problem is, so that then once we have that, we can create a clear treatment plan. Your treatment plan will be customized to you based on the findings we had during your exam. So we will loosen what's tight, strengthen what's weak, look where you have a lack of motor control, as well as any muscles that are just locked up and restricted, or muscles and joints. So we will adjust also the joints that are restricted. So your in-home treatment or at-home treatment would be things like rehab and exercise, any stretching. So strengthening and stretching that we advise you in the office, we'll certainly have you do that at home so that you can continue your treatment where you're not solely reliant upon us. In the office, we would do different forms of advanced massage therapy techniques, so active release technique, fascial distortion model, trigger point work, anything that frees up those tendons and muscles to move smoothly will help you get back feeling better sooner, as well as increasing ankle mobility with chiropractic adjusting, and as well as we'll do in-office, again, activity modification, meaning we would change the way you let's say how you squat or how you lunge. So all of that combined works better to get you feeling better versus just any one of them. So the chiropractic, the massage therapy, and the rehab together combine to get you feeling better as soon as possible. If all this sounds good to you, then I would encourage you to come in. I'm confident that we can help you, and let's explore and see how we can get you back training as fast as possible.